Not when I wash my hands. Hello, Gina.
Hi,
Hi, how are you?
I'm good. How are you?
I'm good, thank you. My name is Camilo Gilaver. I'm the treating physiotherapist today. How are you feeling?
I'm good.
That's good. Gina, do you mind if I have a seat here?
Yeah, of course.
Thank you. As I told you, Gina, I'm the physiotherapist today. So that I can know that I'm with the right patient, would you mind telling me your full name, date of birth, and age, please?
Yeah, Gina Hina, 25 years, and uh, date of birth 14
Whatever.
September.
Yeah, that's great. Thanks for sharing that, Gina, with me. As you can see, this is an excellent situation for me. You will see my suspects on right. They will be assessing me. Is that all right for you,
Yeah,
them
no
to be
problem.
here? That's great. Have you been in physio before, Gina?
No.
This is the first time?
I mean, before it is asking me during the injury.
I was asking like in general.
Yeah,
Have
yeah,
you
I
ever
have been
been
to a
in
physio.
physio?
Yeah.
All right. So
Yeah.
let me just do a quick brief of how my session is gonna look like. The first part is gonna be me asking you tons of questions to get to know you better, know what happened to you. The second part is gonna be hands-on assessment. We'll be planning some goals together, and the third part will be doing some exercises. How does it sound to you?
Good.
Sounds good? That's great. So Gina, I know I have a lot of information here. I just want to double check with you. You got on your right knee an ACL tear
Yeah.
that was like 14 weeks ago, like happened on the 20th of July, if I'm not
17th of July.
17th of July, that's correct. And then 3 weeks ago, you got a surgery done.
Yeah.
They got part of your muscles on the back of your thigh, and then they do a new ATL. Is that correct?
Yes.
Anything else in that surgery?
No.
Any suture or any intervention on your meniscal that was teared, or just
No.
they just left it there?
It was just a ligament that was injured.
Okay, no worries. So, Gina, I know that you were playing soccer. You play like during the weekends. How is the schedule for the games? How, you know, would you mind telling me a little
I
bit more
mean,
about it?
I am a semi-professional soccer player.
And do you
So
play like during the week, during the
yeah, we
weekends?
just go for practices and all of
Alright,
that.
so
Yeah.
it's quite a lot.
Yeah.
I also know that you're quite active, so you practice a lot of sports and you keep yourself eating really good food. And yeah, I also got from your chart that you live in an apartment, the ninth floor.
Yeah.
Is that correct? You
Yeah.
live by yourself. And since the surgery, you have been using your forearm crutches.
Yeah.
Everything was alright,
Yeah.
getting in and out of your house,
Yeah.
walking yourself into the house,
Yes.
not problems at all.
No.
All right, so there is no stairs, no rails, no.
So we do have stairs, but the thing is that I'm using the elevator right now.
Yeah, but when you get from the street to your apartment,
No.
you don't have
No.
to manage any stairs
No.
or steps. No, okay, that's fine. Um, so yeah, Gina, I'm gonna go like a little bit over the history, trying to rebuild all the history. I know that you twist your knee back in the days, and then after a couple, quite a few time, you had the surgery. What happened in between, like why the surgery was not done like early?
So because there was a lot of swelling. As per the
Okay.
doctors, he said that there's a lot of swelling, and they wanted me to reduce the swelling.
Okay.
Now I do not know how is this swelling. I mean, it's there till now, and I'm really scared.
For
You
sure.
see, I'm not able to make my knee straight, and I'm really scared about it.
For
Like
sure.
since you're asking me what happened before, the moment I had the injury, I had the swelling, and they said that don't go in for any surgery, do physiotherapy.
For
So
sure.
they made me do a few exercises. They asked me to do it, and I have been doing it very regularly. I mean,
Would you mind telling me what sort of exercises you did?
So they had asked me to press my knee downwards.
All right, like so.
Yeah,
All
yeah,
right.
make it very tight. They asked me to do my ankle toe movement.
Okay, cool.
Okay, then they asked me to, initially before the surgery, they asked me to even press my heel down. They asked me to do something with my buttocks, squeezing of my buttocks.
All right.
And they asked me to maintain the range.
For sure. So
Yeah.
probably those exercises were really good in terms of trying to reduce the swelling and trying to keep your muscles working and trying to keep your knee, the range of motion of your knee.
Mm-hmm.
All right. So You did them like pretty well with no problems at all?
Initially it was painful, but then I was like, I need to get this sorted. That's the
Yeah.
reason I just kept
So
on
just
doing my
kept pushing
exercise.
it.
I kept on telling them, show me more exercises, but they were like,
Yeah,
slow down.
probably was not better exercises because you were having to wait for the surgery to be done, and then now that you got your new ACL, we can start to progress on the exercises. All right. So since you got the surgery done, how is the life going? How is everything going? How are you feeling about it?
Um, the only thing is that I'm concerned that I want to get back to my game. I'm
Okay.
not able to make my knee straight. I'm not able to bend my knee. The swelling is not going. I'm
Okay.
asking them to show me more exercises. They're not showing me. Now,
Okay.
can you please tell me what is it? I mean,
For sure. No worries, Gina. So, have you been done any physiotherapy in the first 2 weeks?
yeah,
Or
they told me to do the exercises. They asked me to do it, and they told me that I have to go in for my follow up. I guess in the
alright,
next 4 weeks
the next
time.
2 weeks.
Yeah.
Yeah.
So
So, but you haven't done any physio appointment in the last 3 weeks after the surgery?
I have.
Yeah.
I've just gone once, twice, and they told me to do the exercise at home.
All right. And
Yeah.
that happened when that happened?
That
When was the
happened, so
appointment?
say, initially when I was in the hospital,
Yeah.
they made me do my exercises.
Yeah.
Then after, you say like 5 days after I got discharged, they told me to call me. They called me again for a follow up.
All right.
So I did the exercises with them, and then they told me now at the fourth week,
Yeah.
I have to go to the doctor.
Oh, okay. So
Yeah.
no physio appointment in these 3 weeks
No.
time after surgery. Easy. That's really good. And what about your weight bearing on that right leg? Are you able to weight bear on that leg? Is it too
Yeah.
painful?
It is paining,
All right.
but then I really want to walk. I really want to go back to my game.
Yeah, for sure. You just want to get back to
Yeah.
your normal game. For sure, Gina. So tell me if you could put a number or a score between 0 and 10 to your pain. 0 is not pain at all, and 10 is the worst pain that you could ever imagine. How would you rate your pain first thing in the morning?
You can say somewhere 5 or 6. It's basically stiff in the morning,
It's really steep. All right.
and then gradually after I bend my knee,
Yeah.
it starts loosening up a bit.
Okay.
Yeah.
Easy. So how better it comes? So what number would you say after the stiffness goes and then you start moving? How's the pain there?
Then I think it's like a 2 or a 3.
Sure.
Yeah.
It's not too bad.
Yeah.
I know you're a soccer player. You have had quite injuries. I was a player myself, so I know how it is to, you know, feel the pain in your knee, and you just need to get rid of it. I know. I feel you. No worries, Gina. And let's say that what sort of things aggravates your pain? Aggravates your pain?
So at the moment, if I try to bend my knee more,
Like getting
yeah,
push your knee.
yeah. So
All
that
right.
hurts me. Additionally, if I'm going to put more weight on my leg, that again starts hurting me.
All right. So how bad is the pain on that moment when the aggravation comes when you try to bend the
It
knee?
goes roughly 6.
6. And what
6
about
to
trying to
7.
put weight? The same 6 or 7?
Yeah.
Okay.
If I
Easy.
try to increase the weight,
What sort of things alleviate your pain?
if I'm resting,
All
if
right.
I'm trying to keep my knees straight,
Okay.
if I'm applying ice,
All right.
and
Those
the
sort of
medicines.
stuff.
Yeah, all those things.
All medicines. And what about in terms of your medicine? What are you taking now for like any painkiller?
So it's SOS, like I'm
Just
supposed to.
when you feel your knee?
Yeah.
All right. And have you taken so far?
So today before coming in, no, I did not. If that
Okay.
is what you mean.
All right. Do you mind asking me how is your pain now that you are sitting there?
Right now, I don't have pain.
So would you
No.
say it's a 0?
Yeah, right now it's 0.
Okay, easy. And so, but Gina, do you feel like you need more pain medications, or you feel like you are coping well with the
I
pain?
think I'm doing well with the pain. I just want to go back to my game, just get this sorted for me.
For sure.
Forget the pain.
I mean,
I'm not concerned about the pain.
The pain is gonna be there for a time, you know. And I know that you want to get back. You want to start running now, and you want to start, kicking
Yeah, because
kicking ball now.
I feel that I've gone one step behind. I don't know whether the
Yeah.
surgery is helping me or no.
Yeah, for sure. Well, let me tell you something. The ACL is one of the main ligaments that protects your knee and give them stability. You know. So because you have the tear on that ligament and was completely broken, now you have a new one. But we need to give some time so that ligament there which is not actually a ligament, is a tendon from the back of your thigh, needs to heal, same as your knee, same as the swelling. So we can't go, really fast because that's gonna harm you. And
Okay.
I know you don't want to get late on, on your season and stuff like that. So yeah, for sure, we need to take steps slowly. Make sense to you?
Yeah.
But I'm also fully committed to go with you and try to make the best out of the sessions. Okay, Gina?
Yeah.
Great. So, um, I think that I have quite a few information. Just confirming, you don't have any medical condition previously, like
No.
you don't take any medications
No.
apart from this SOS medication. I know you don't smoke and you just occasionally drink.
Yeah.
What is occasionally, and if you don't mind me asking, how much is it? I have to. This is my repeat care.
So it's say twice a month.
Twice a month, so it's
And
pretty enough.
yeah.
Pretty much enough. All right. Fair enough. Keep that way. Stay away from smoking. Don't ever do that. And alcohol, that's all right. Keep that way. All right, because that's the best way to keep you healthy and make your rehab shorter. Okay. And yeah, do you have a job? Are you work? I know you are not working now, but do you have a job?
No, as I told you, I'm a semi-professional soccer player.
So that's kind of your job.
Yeah, that's my
All
job.
right. And now you're in a leave, in a sick leave.
Yeah, so
What is your status now?
so that is what is the thing. Like right now, they kept me on leave, but the thing is that just because of this, like my knee, if I'm not able to go back to my game, I'm worried that they will replace me. And
Replace with somebody else.
yeah,
I get
yeah,
your
yeah.
point.
Because I mean, if you see right now, I was told that I will be able to bend my knee, I will be able to walk, I will be able to run.
Yeah.
But you see me right now, I'm hardly able to bend my knee beyond 90 also. So that
For
is
sure.
like something that is taking a toll on me. I really want to get this fixed.
Yeah, for sure. So, but do you
So as
feel?
per you, how long will I take to heal?
Well, basically it takes somewhere between 4 months to 6 months.
Okay.
All right. So that's an average. This is, that everybody behaves different. Every person is different. You are pretty active. You are 35. You don't smoke. You don't drink much alcohol, and you are pretty active. So that will benefit you for sure and make your rehab shorter. All right. So yeah, Gina, I'm gonna try my best and see at what point are you now and what sort of things can we do to make everything faster. All right, but there is some process, sometimes healing process that we need to respect in order to keep your knee safe. All right. So Gina, do you think you're coping well with all these emotions that you're having now? Because you told me you are not able to practice and you're concerned about being replaced. So do you feel you need any sort of assistance on that end? Or do you think you're doing well?
I don't know.
You don't know really?
Yeah.
So what about thinking about counseling will be something that you could consider?
Okay.
Somebody, can come, you can come to somebody else's place, another health
Okay,
professional.
so I think they will help me to just relax a bit
A
and
little
get
bit.
this sorted for me.
For sure, and put things in perspective as well. So
Okay, so then they will take care of it, right? I don't need to worry about that, right?
about what? Sorry.
Like my job, my work.
No. What I'm saying, Gina, is that the counselor will put things in perspective for you and try to, process everything that is happening to you and maybe be able to help you on emotional
Okay.
part.
Okay.
But if you need any sort of assistance in terms of your job or financially, is that what you're telling me?
No.
Okay, easy. So, Gina, I'm gonna just rule out a few red flags things that will require further assessment. Sorry. Have you ever experienced any pain in the back of your calf, like
No.
sudden pain or inflammation, just here,
No.
or any shooting pain there? All right. Have you been doing your ankle pump so far?
Yeah.
That's great. And what about any sudden weakness in any side of your body?
No.
Any problems with your vision or hearing or smelling or tasting,
No.
articulating your words,
No.
swallowing problems,
No.
chest pains,
No.
cough or night sweats or
No.
chills or fever? Any problems with your bowel or bladder?
No.
Any sudden sensation impairment in any side of your body?
No.
Okay. Anything that you think it's important to add to your history?
No. I just feel this tingling pain sometimes in my leg over
Was
after
that after the surgery?
Yeah, after the surgery.
And what is the tingling pain?
So it's around this area.
All right. The tingling sensation is pretty normal. It's very easy to expect after surgery. Two reasons why. Because there is a lot of swelling around the knee, and because you had a surgery done, there is, you know, the skin was cut, the soft tissue was cut, so it's pretty normal to feel that tingling around the, especially around the knee when the surgery was done. All right. So, but that should go away now, in a time, you know. All right. So, Gina, what are your expectations from today's session?
I want to get back to my game.
For sure.
And I want to walk better.
For sure, that's something that we're gonna keep in mind as a long-term goal, Gina. But what about today's session? If you could think something to achieve from today's session, what would it be?
Or maybe to walk better.
Walk a little bit better.
Yeah.
All right.
And can you please show me a few more exercises?
For sure, we can do that. We're gonna do that. So exercises, like try to improve the exercises and walk a little bit better would be something that you want to achieve today. Yeah. Right. I'm into that for sure. So Gina, I will start my hands-on assessment. Is that all right for you?
Yeah.
No problem with your upper limbs. Upper limbs working great.
Yeah.
I know you have your 2 foot crutches and you're using them the whole time for walking inside the house and outside the house.
Yeah.
Is that correct?
Yeah.
All right. Good. So, do you mind if I put my hands on your thigh? Is that all right?
Yeah, yeah.
Cool. So, do you feel this?
Yeah.
Does it feel normal?
Yeah.
Do you feel this?
Yeah.
Feels normal?
Yeah.
Here?
Yeah.
Here?
Yeah.
Here?
Yeah.
Down on the sole. Oh,
Yeah.
sorry, it's a bit tingly.
Yeah.
I know. What about here?
Yeah.
No problems at all? No problems here?
No.
Easy. So, can you please put your knee up toward the ceiling for me? Easy. Extend your knee. And wiggle your toes up and down. Up and down. Right. Down. Now, would you be able to do the same with the right knee? Knee up for me. First thing, put the knee up towards the ceiling. Yeah. Now try to extend your knee. And now try to wiggle your toe up and down. Alright. I forgot asking you, are you using your brace? Is it locked from 0 to 10?
Yeah. Not from 0 to 10, but I'm able to take it to 90.
Alright, to 90.
Yeah.
Alright. So you are allowed for the surgeon?
Yeah.
No worries. So 0 to 90 is the range of motion that is allowed by the surgeon.
Yeah.
I just want to double check. So you're not using your brace now?
No.
Easy.
Right now, because I was coming here.
Yeah.
I just.
You just took it off.
Yeah.
All right. Easy. So because you're now in the plinth, would you mind laying up, facing up for me, please? Just
You want me to lie down?
Yeah, lie down, facing up for me, please. Do you mind if I put this pillow under your head so you can put your head over here?
Okay.
It goes that way. All right.
It's just that I'm just being a little careful.
For sure. I got my goniometer here.
Okay.
I would like to see how is your knee. Is that the further you can go with your knee? Because it looks pretty good now.
Yeah.
Now it's a little bit bended.
Yeah.
So that's the further you can go. Is that correct?
Yeah, this is it. I mean, beyond this, imagine this is 10 people.
All right. I'm just gonna take my pillow here. Sorry.
Okay.
And I'm gonna see with my goniometer how is it. So let's say that the extension is minus 15 or something.
Okay.
All right. So that means we cannot get to full extension.
Okay.
Do you mind if I have like get a little bit of overpressure here? All right.
Stretching.
All right. Are you feeling stretching probably the back of your knee?
Yeah.
All right. So that's the further we can go.
Yeah.
All right. So still being minus 10, just a little bit better.
Yeah.
But yeah, there is definitely a lack of extension. All right. So now I would like to see. Sorry. Are you able to strengthen the knee for me, please? So can you go further? The further you can go. So let me see. Same minus 10. Too painful?
Yeah, it's stretching.
Stretching? Is it painful?
It's just stretching.
Alright, so what about if I try to stretch a little bit? Does it comes to pain?
Yeah, it's paining then.
Alright, so what number would you say the pain is?
It's like 5 right now.
Alright, so we don't want to go over a 5 in any exercise, alright?
Okay.
5 is our goal. That's 20. So yeah, we don't want to go over a 5, alright? Any exercise, any movement that we do today and in the future sessions, I don't want to go over a 5 out of 10. Okay, alright? That's gonna keep us in the safe zone. Make sense to you?
Yeah.
Okay. So, now I would like to see how are you bending your knee. So can you please bend the knee for me? Alright, so that's the further you can go?
Yeah.
Alright, let me take my goniometer and let's see it is 75? 70?
75.
75. Easy. So 75 of active range of motion, and let me see if I can go a little bit further. 90. 90 the further we can go. Is it painful probably in front of your knee?
No, it's not painful at the knee, it's only at the sutured side. There. There's nothing. This part.
This part, yeah.
This part, yeah.
Alright. Alright. No, apart from that,
no.
Is it painful here in the
No.
Alright. The scar?
No.
Not pain at all.
It's a stretch.
Stretching. But if I go.
My results have come. Can you pause it?
Okay, my patient was in a hurry now, but now she's back. She's okay now. So we were assessing your knee apparently. So we were just talking about you were feeling some stiffness on the surgery side.
Yeah, the surgical side.
Alright, but it's not pain.
No, it's all
right. So what about if I try to bend a
If
little
you
bit?
exceed it?
No, just 90.
That's okay.
Alright, so let's say 90 is the, I'm not going to go any further because that's also a precaution.
I think, you know what, I want to just make my knee straight, bend it, then I think I'll be able to increase the
For sure.
movement.
So did anybody told you about when you were laying down or when you were in the bed, try to keep something under your ankle so that the gravity can actually pull down?
No, I've not been told this.
That's something that you could actually do. Put something under your ankle and let the gravity make your knee fall, so you can also stretch that part. All right. So that's the first thing. The second thing that I want to do with you is because there is a lack of knee extension. So I just want to assess how is your strength on your hip and your knee. Okay. So would you mind putting your knee up for me? The knee up. All right, and try to hold it there. Put your hands down and try to hold it there. Right? Now press my hand. Good job. Back. Now try to extend your knee, please. All right, and I'll try to bend your knee a little bit. All right, is it painful?
No.
All right, try to put your toes up for me. Up. Good job, and now press my hand. Well, pretty good job. You're doing an amazing job here. So, I know you have been doing straight leg raises, but I just want to make sure we can work on the last degrees of your quads. Alright? So, for that, I'm going to give you a very boring exercise, but it needs to be done in order to gain your knee extension at the end. Alright? So, 10 times you're gonna put something under your knee, hopefully something a little bit longer, and try to extend the knee like that. Alright? 10 times. Alright? It's gonna be really boring. I know we're not expecting this, but the next exercises will be a little bit better. Alright? 10 times for me. Alright, so what are we doing now is working on the last degrees of knee extension. Alright, so that's what we need in order to keep your knees straight when you are walking or doing your exercises. Alright, makes sense to you? Do you have any questions for me so far?
No.
One more time. 9. And let's say 10. Alright. Let's see now how are you walking. Alright? So come down to the knee for me. Okay. Here are your forearm crutches. So show me how do you stand up from the chair or from the bed.
I'm putting it onto one side.
Alright?
Okay, I'm putting it onto the chair.
Good job. Alright. How are you feeling there?
Yeah, good.
Feeling okay? Dizziness or something? No? Alright. Can I put my hands here? So, and please load a little bit that leg and tell me how is the pain going?
When I'm increasing the weight, it's hurting me, but okay.
Hurting till a number of
So 5?
5. Still good. 5. Alright. Now, can you do 2 steps to the right for me, please? 1, 2, and then 2 steps to the left. Alright. Any problems with that? Pain?
Yeah.
Alright. Can you do some marches on the spot for me? Like trying to, yeah. Cool. Now, keep your right knee up for me, please. Keep it there. Good job. And now change to your legs. Alright. Sounds pretty good. Are you okay with it?
Yeah.
Alright. So, now I want to see how are you walking. So, just to see how are you at now, I want to do a time up and go test. So would you mind having a seat here, please? And I'm gonna watch how are you walking. All right. Have you ever done a time up and go test? No. Well,
What is it
are.
for?
I'm gonna show you first the exercise, and then I'm going to let you know what are we gonna do this for. So can you see the 3-meter mark there? What I want you to do is when I say go, you're gonna stand up and walk as fast as you can in a safe pace. Go, go. You're gonna go to the 3-meter mark, turn around, get back and have a seat. All right? We're gonna time how long does it take for you to do the whole lap and see if where are you at, you know, in terms of the risk of fall, and also we'll be assessing how is your gait.
Okay.
Make sense?
Okay.
Are you ready?
Yeah.
1, 2, 3, go. 4, 5, 6, 7, 8, 9, 10, 11, 12, and 13. All right, very good, Gina. You did a really good job. I just was able to catch a little gait impairments on your gait, and also your time was good. So that means we are doing pretty well. All right. So, would you mind standing up for me, please? The first thing that I want to do is try to put in some load on your knee there. All right. If you don't mind, now you are using your short forearm crutches. I will see. I wanted you to give 1 step with the right and then 1 step back. Just this movement and back. All right. Good. How's the pain there? I know you're pretty good with pain, but I want to know that we are not going over a 5. Remember that?
I think it's 5.
Is it a 5?
Yeah.
All right.
4.5, 5.
4.5, 5. All right. Fair enough. All right. And that's it. Now that you are holding onto your forearm crutches, I want to do 10 hip flexions. All right. 3, 4, 5, 6, 7, 8, 9, and 10. All right. Do you want to have a seat?
No, I'm okay.
Are you okay? Cool. Let's go for a walk again. Now, I want to show you while you are walking, this is what we're going to do. First, crutches go to the front of you, then the right knee, and then the left one step through.
Okay.
All right? So it's going to be crutches, right and left through. Crutches, right and left through. All right, and this way. Crutches, right and left through. Crutches, good. Crutches, right, left through. All right. As you can see here, you're like bending a little bit forward. So I'm just gonna make sure the crutches are good for you. So I just want to adjust it, but they seem to be pretty good. I know that they measured them back in the hospital, so I just wanted to make sure they were okay for you. So try to keep your back straight, crutches, right and left step through. All right, much better. Are you able to do it a little bit faster?
Yeah.
Now you will see that feels much better. How do you feel?
Yeah, better.
Feels better? Yeah. All right. All right. Now take a seat here. Sorry. Ah, yes. Got the laptop here. So. Okay. So overall, your knee is working pretty well, I think. Still be very restricted to over 90 degrees, but that's what the surgeons say to us. All right, we shouldn't go over 90 degrees. Your knee, when you are walking, looks pretty good. Seems to be really stable. Mm-hmm. So I would like to know, how do you do with just one crutch? All right. Yeah, do you think you can do that?
Yeah, of course.
For sure. All right. So what are we gonna do now? Is try to walk with just one crutch on the left side. All right. So what are we gonna do is left crutch goes with the right, and then the left goes step through. All right.
Because you take one crutch.
Just one crutch. All right. All right. And I want to know, how are you doing with just one crutch? Okay. If the pain doesn't go over the 5, let me know. If it goes over the 5, then we step back and go with just 2 crutches. Okay. All right. All right. So what are we gonna do now is left together with the right, and then the left leg step through.
Okay. Okay.
All right. Back. Good. All right. I'm just gonna move this thing out so you can walk a little bit longer. That's all right. You look pretty good, Gina.
Yeah.
All right, a little bit faster, looking forward. Yeah.
I mean, it's something new, so I mean, I'm just.
I know you're used to look the floor. That's all right. All right. Now we're gonna do some proprioception exercises. All right. So I want to do. Let's go to the parallel bar. Let's pretend we're in the parallel bar. So step into the parallel bar with me. All right. Gonna put the crutches away, and then you can hold on onto the bar. Okay. So what I want you to do is, do not hold, just slightly touch them, just in case you lose your balance, and do mini squats. All right. All right. How are you feeling there?
Yeah, I'm feeling good.
Just gonna put the chair just behind you, just in case. How is the pain?
It's 4, 5.
It's
not exceeding that.
Yeah, it's pretty good. All right, so this is gonna be one of the exercises that I want you to do at home. All right, it's gonna be the second exercise to do at home. Okay, so it's gonna be there. You hold 1, 2, 3, and then the extension. All right, 1, 2, 3, and extend. Any questions on the exercise? All right, 2, 3. Remember, even at home and here, not go over the 5. Okay. It's not going to bring you any benefits. Okay. All right? 2, 3, then go back. 1, 2, 3, and then go back. And if you feel like you don't need to hold on to the bar and put your arms like that, it's going to be way better. Good job. How do you feel there?
Yeah, it's a little tiring.
I know, but that's what you wanted.
Yeah.
You want to,
Yeah.
give you some challenge.
Yeah.
So I'm happy that you're feeling a little bit of tightness and even your legs.
Yeah, but it's feeling good.
All right. So the third exercise is gonna be heel rises. Heel rises and then toe rises. It's gonna be like rocking back and forth. 10 times. Alright? Try to don't hold onto the parallel bar or onto, you're gonna do it with a chair in front of you at home.
Yeah.
But if you cannot hold onto the chair, that's way better because that's gonna give you more balance input and balance activities.
Okay.
Challenge. Alright? You're gonna want to challenge your balance, your perception, and yeah, that's alright? 10 times. Probably this exercise is not gonna overexert you. No? Are you feeling okay? Pretty good. Alright. So let's go for a last walk. See how are you doing, and then we are going to do another time of bend up. Alright? So remember, left crutch goes with the right, and the left step through.
Okay.
Alright?
I feel more confident.
Yeah, that's great. I can see you're way more confident. You're walking more natural now.
Yeah.
All right, let's go to the chair. Back to the chair. Okay, how are you feeling?
Good.
Good? How's the pain?
Yeah. I
Alright.
mean, it's lesser.
It's less. That's okay. So, same thing, same that before. When I say go, stand up, go to the 3-meter mark, come back and have a seat. Okay? You ready? 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wow, you were almost running. You were running. That's so good. That's so good and so happy. You did much better than before. Your tail pattern is way better than before.
Yeah.
Alright? So that's the first thing. So you are going to keep doing that at home. Remember what we learned today, and keep doing the 4 exercises that we learned today. Alright?
Yeah.
So it's going to be just wrapping up. It's going to be the first one. It's going to be with a towel under the knee and try to get the last extent of knee extension.
Okay.
Alright? That's the first one. The second one is going to be
Squats.
squats, mini squats, 10 times. Alright? The third one,
Heel raise.
that, and the fourth one is going to be your gauge pattern. Okay? Any questions
No.
on the exercise that we did today?
No, I just want to get back to work soon.
For sure. The next time we probably will be able to, it's going to be less questions and more exercise on the next session, the following session. So we can include, I don't know, a ball or something to start getting slowly back to, the game. All right? So can you please walk back to the plane?
Yeah, sure.
I just want to make sure we have done something on the range of motion. All right. Now. All right. So before it was minus 15. So now I'm expecting a slight change. Could be like minus 10. All right. Less. We improved like just 5 degrees, which is okay. I'm happy with it. All right. So. What about the knee flexion? How far you can go? All right. So now before it was like 75, and now it's 95, which is pretty good. I think.
Yeah.
It's pretty good. So keep doing that. Keep doing the exercises. Today is Tuesday. I want to see you again on Friday. Is that okay for you?
Yeah.
Do you have any questions so far? Right. See you on Friday.
Thank you.